Good afternoon, and thank you for joining us. Welcome to the first in a series of events that will provide you with information about the Work at Health program and issues related to workplace health. Each event will be hosted by a member of the Work at Health team who will interview special guests on various topics. Today's event, Work at Health Program Update, will provide an overview of the Work at Health initiative. Before we begin, a few important notes. This event is being recorded. The recording will be available upon request to the Work at Health customer service for future reference. Audio for this event is provided via broadcast. To pose a question, please use the Q&A panel on the right-hand side of your screen. We have some time set aside for questions at the end of our session, but you may submit your inquiries at any time. Lastly, please note that this session is provided for informational purposes only. Employers should consult independent professionals to discuss how specific matters relate to their individual businesses. Now, I'd like to introduce today's special guest. Jason Lang is the team lead for workplace health programs at the U.S. Centers for Disease Control and Prevention, including Work at Health. Since 2007, he has managed projects and provided leadership for the National Center for Chronic Disease Prevention's Workplace Health Initiative. Welcome, Jason.
Hi, Nikki. How are you? Hey, you need to introduce yourself.
The interviewer is less important. Again, I'm Nikki McCoy. I'm the Director for Technical Assistance for the Work at Health program. Thank you so much, Jason. I appreciate that. All right. Well, Jason, I'd like to just go right into asking you some questions, if that's all right with you.
Sure. Go ahead.
All right. Well, many of the folks on the line today are familiar with Work at Health. But for those who don't know much about the program, can you give an overview of Work at Health?
Sure, and again, thanks for inviting me today. It's a real privilege to be able to talk about Work at Health and connect again with so many people who've been interested or joined in the program so far. Very simply, Work at Health is a training program for individuals interested in developing knowledge and skills that are needed to build and sustain effective science-based workplace health and wellness programs. One of our key goals for Work at Health has been not just to provide information and increase knowledge of participants, but really to enable them in the program to use that knowledge and skill and take action. So Work at Health was developed to be more than just sitting in a classroom or in front of a computer screen listening to an instructor. Following the core training curricula, participants enter a technical assistance phase that provides more individualized coaching and support over several months to help them move to take action. That action is to actually put in place a few workplace health and wellness strategies that meet a specific wellness need or that the employer and the employees are interested in so that the health of the organization and its employees can be improved. This is what we refer to as the employer arm of the program. We also have developed another arm of the program that we call the Train the Trainer, or T3 arm. The goal for this group of participants is to not use the Work at Health training to make improvements or start a wellness program at an employer work site. Rather, the T3 participants are wellness professionals who work with many different employers in their states and communities across the United States. And the training that this T3 group receives prepares them to deliver the Work at Health employer core training to employers that they serve in their communities. So just like the employer participants, there is a technical assistance and coaching period for the T3s after their formal training to prepare them to go out and train other employers back at home.
Well, I think, Jason, both of you and I would agree that Work at Health is an exciting program. Can we talk a little bit about how the program started and how long Work at Health has been available?
Yeah, CDC started to develop Work at Health in conjunction with Ashland Management and RTI International in 2013. One of the first things we wanted to understand better was, one, is there a need for this type of employer training? And two, if there is, what would be the specific needs that would inform the development of Work It Health? We spoke to a number of experts in the field, including researchers and practitioners, and one of the top needs that was consistently mentioned to us were more opportunities for employers to learn how to develop wellness programs that were built on solid, sound scientific principles. There's some great training programs for professionals out there, and there's some fantastic conferences and annual meetings that, discuss the cutting edge, state-of-the-art science for worksite wellness. But overall, we didn't find a whole lot of examples of workplace health training programs in either the literature or in speaking with the experts that focused on kind of the scope that we had envisioned for Work It Health, which was to really take a broad organizational view of implementing a comprehensive workplace health program that looked to improve both the health of employees but also improve the work environment to better support healthy lifestyles for those employees. We also didn't see many examples of training programs that extended beyond the initial course or workshop where, the trainees came in to learn about this kind of stuff. So that kind of presented a challenge where they didn't have a lot of opportunity to improve and refine their skill. This was a major driver for the development of the technical assistance phase for Work It Health. And lastly, we found a few examples of training programs that had been evaluated, and so we were really interested in evaluating Work It Health to contribute to that overall knowledge base. After that, we did some key informant interviews, and we did a survey with employers to learn more about their training needs. We asked a number of questions ranging from their interest in a wide array of different wellness topic areas, culture, productivity, specific types of strategies, how knowledgeable they already were, what were their main motivators and barriers to either offering a wellness program at their work site or to participate in a training program on wellness programs. About half the employers we surveyed had a program in place and the other half didn't. And of those who reported to us that they did have a wellness program, about 2/3 of them said that their program was 5 years or less in age. And so this was really the group of employers that we initially targeted for Work It Health, employers with a relatively short track record of experience when it came to wellness programming. We also asked about the best ways to deliver training, how much time are you willing to commit to it, who would be the best person in your organization to participate in training, and if it was offered to you, how interested would you be and willing to enroll in that kind of program. A very positive sign from this survey work was we found a pretty high level of interest in training opportunities that could move employers along their wellness journeys. Our formative work showed that about 75% of those who were surveyed were either ready to build or expand their programs, but before taking action, they needed some kind of additional support to kind of be a catalyst. So that was encouraging to us, and we took all of that information and we put it together with the available tools and resources and models that we had developed at CDC or were available publicly from other sources and began to put the curricula together. That process took us the better part of a year to put that curricula together and to pilot test it with a small group of employers and T3s. As I mentioned, we're interested in learning not just about what to train on, but the best ways to deliver that training. So when we pilot tested Work It Health, as well as in the full-scale implementation of it last year, we assigned participants to receive the training in one of 3 different ways. They either got the training purely online, they got it in a traditional classroom or workshop-type style with live instructors, or there was a third way that we called the blended model where there were elements of both that online and in-person training. We also had to build the technical assistance component of the program. We developed the TA portion of the program to leverage and be an extension of the content that was delivered in the training. For some of the participants, they had several months from the time that they were trained to the time they began the technical assistance phase. And again, we're working with many employers who didn't have a whole lot of experience in this type of comprehensive programming. So we felt it was really important to use the technical assistance phase to repeat and reinforce the concepts that were presented in the initial training. The employer technical assistance phase was built around 4 key milestones that helped the participants understand the different health needs in their organization by collecting or using data, using that data to develop a plan to address that health need, turning their plans into action by implementing a wellness strategy, and if they weren't doing a formal evaluation at the end, at least they were having a strategy or plan put in place that after some amount of time, that wellness strategy they put in place could be looked at in terms of its impact. The T3 group also had the technical assistance phase, but they had 3 milestones instead of 4, and theirs were focused on planning for delivering the Work at Health training to 5 employers in their community, recruiting those employers and actually conducting the training, and then debriefing with other train-the-trainers to learn about how to improve the delivery of their training that could be a benefit to future participants. So after all of that, we were ready to take Work at Health to a much larger audience. So we began to reach out and recruit participants early last year and began training employers and train-the-trainers across the country in March 2014. We established regional training locations from coast to coast, including sites in Baltimore, Chicago, Atlanta, and Oakland, California, and completed all our initial trainings in June of last year. After all that training was conducted and concluded, we began the technical assistance phase with the employers and train-the-trainers, which went through December of last year. So overall, during that whole first year, we ended up training more than 200 employers and T3s from around the country and actually covered 42 different states and territories.
Wow, Jason, it sounds like you and the team have certainly been busy. Now, we talked about 2014. What's in store for Work at Health in 2015?
Yeah, there's definitely a lot of moving parts behind the scenes that go into the program, and everybody's really been hard at work for the better part of a couple years. One of the challenges for us has actually been to develop and refine the program while at the same time offering it to people to participate in. Everyone on the team's been really strongly committed to helping employers help themselves and build these wellness programs that we know are going to work, but you never really know until you kind of put it out there what's going to happen with it. And so, you know, we've had to make several adjustments along the way to move this from the drawing board, you know, into real-world practice. And, you know, my hat is off to all the participants in that first year who've been really great in understanding and being patient with us as we go through our growing pains. And we certainly look to continue to learn and grow both ourselves and with them for 2015. In the current year, we're really excited to be able to provide additional training opportunities for employers and wellness professionals, the T3 group, that we hope are going to meet a collectively shared goal to help improve the health of workers across the country. You know, we will also be planning to work with graduates of the program, people who've already been involved to date, as well as incorporate some new participants into the program. And so this current effort we are calling Work at Health Advance for 2015.
Thank you, Jason. Before we move on to taking questions from the audience, can I just ask you to tell me just a little bit more about Work at Health Advance and the Advance program?
Sure. You know, if you look up the word advance in the dictionary, it really simply means to move or bring forward. So we wanted to take what we learned last year, build on that, and move it forward. You know, we started Work at Health as a basic level training course to really lay a foundation around these key concepts and principles for effective, sustainable workplace health programs. We felt was really important before employers would run into making changes to their vending machines or starting on-site exercise classes or putting tobacco policies in place, that they really understood how to build sustainable infrastructure for their program, you know, which would include getting leadership support for the effort, you know, how to collect and use different types of health-related data to drive decision-making, how to really effectively plan for and implement all the things that go into a program, from communications, whether or not you're going to offer incentives, you know, all those kind of things. And then, you know, at the end of the day, how do you measure this? How do you know if what you did worked or not? We saw that a lot of participants had lots of enthusiasm. They wanted to get right to work, bring wellness programs to their employees. So we had to put the reins on them a little bit, ask them to take this step back, look at the bigger picture, and really focus on building that core set of competency and skill. To not just offer that first walking program that they did, but to be able to build from that and grow and sustain it over time for the long haul. What we found during that first year is that this educational and skill building process took most of the participants the entire training and technical assistance period to work through and begin to master. We felt it would be valuable to continue to work with these participants and offer them additional support, coaching, mentoring as they kept working on their individual skills as well as their worksite programs back at home. So last fall we began to plan for more advanced level training and technical assistance that employers who have participated in the program so far could enter into. Employers who have completed the basic core training and worked through the 4 technical assistance milestones that made up the TA phase will be eligible to enter this advanced level training. Other employers who went through the basic Work at Health training from the T3s but did not get to go through the technical assistance phase, they'll now be eligible to go into the basic technical assistance program and work through those same assessment, planning, implementation, evaluation milestones that the group last year did. So whether they're interested in planning for and doing a stress management program or putting a healthy food at meeting policy in place, that's what the basic TA program can cover. Speaking of those T3s that trained employers, we haven't forgotten about them. Just like the employers, we want to provide them with opportunity to engage with us and continue their skill development. This year we'll be offering Work at Health, the Work at Health Train the Trainer program to a completely new group of professionals that are interested in training employers who we've not had the pleasure of working with in the past. And for those T3s who graduated the program last year, we are developing and will offer a master trainer program to provide a process and the skills needed for those certified trainers to prepare other professionals to deliver the Work at Health training to employers, you know, where they live and reside. So rather than learning how to train employers, these master trainers will bring new T3s into the Work at Health community. Some train-the-trainer graduates may also be interested in working more closely with employers, more in the role of a TA provider, and there's also going to be some opportunities for them to do that as well. So all of these things together we are kind of collectively referring to as Work at Health Advance, because again, we're trying to build on what we have learned and move the program forward.
Thank you, Jason. This is very exciting. I think we're going to, thank you for providing this information. We're going to go ahead and start taking some questions from the audience. Just want to give everybody instructions that they can submit questions to the audience by selecting the Q&A panel on the right-hand side of the screen, as you'll see there in the graphic. So please do feel free to submit your questions. All questions submitted are anonymous, so don't worry about me calling your name. And we will get Jason's expertise as we go through the questions. So our first question, Jason, from the audience is, how can we sign up to be a certified trainer through the program if you are already a T3?
How can you sign up for the program if you're already a T3?
Yes.
Is that the question?
Yes, that's the question. I'm sorry.
Yeah, we have the, different communication mechanisms, constant contact lists. We have our program website. We're excited to be able to offer kind of revamped, reconfigured online learning platform. We're calling this new platform the Training and Technical Assistance Hub. And so there are multiple ways to kind of seek out proactively information, or, we know who our graduates are. We know who our participants have been, even if you did not complete the program. And so if you're not reaching out to us, we'll be reaching out to you. The last thing that I think may be on the final slide for today is the Customer Service Center unit that has also been established for 2015 moving forward. This was arose from a lesson learned we had with the operations of the program last year, and this group of folks, are at the ready to be able to take inquiries, take questions, refer and triage them to the most appropriate people to be able to respond back and get timely responses to people who have them.
Thank you, Jason. I'll just say that at the end of the presentation, there will be contact information for interested participants, and we can help you get signed up and take care of that. Our next question from the audience is from an employer, it looks like, and says, can Work at Health participating employers become trainers?
They certainly can if they have the interest and the commitment to go through that process, and they want to, be kind of ambassador locally in their community to reach out to other employers. They certainly are able and eligible to do that. I think looking at our first year data, which we also had that opportunity available to people last year as well, employers in particular, that most of our Train the Trainers seem to come from a couple different types of groups. They tend to come from either the public health community, state and local health department type of folks. They may come from the provider community, and it's specifically broker vendor type of people. And then a third group might be some of the nonprofit coalition type of groups that have some health focus with them. So, we've seen participation kind of group and cluster in those different types of areas, but certainly employers who are interested in learning facilitation skills to train people using the employer curricula, the Work at Health curricula, would be able to do that if they are interested and eligible to.
Great, Jason. For employers who have already participated in basic training and the technical assistance, what will the advanced technical assistance look like?
Yeah, we think this is going to be pretty cool. Again, we're trying to continue to refine, improve skills for the employers who have already gone through basic. We know it takes time to master these kind of things. So in some ways, it's going to be an extension of concepts and principles they've already learned. But we also know employers, generally speaking, are, they like to be recognized for what their programs have been able to accomplish. And so we've gone out and kind of of scoured the universe and found a number of third-party accreditation and recognition programs, and we are going to target the technical assistants to be able to assist and prepare employers who go through the advanced program to be able to pursue the third-party recognition or accreditation program that they're most interested in or meets the need or is the best fit for their organization. So we've looked at a number of these programs. We found common elements across them, and we're developing a technical assistance process that involves the employer, of course, the technical assistance coach or mentor, as well as some computer-assisted technology to help them figure out where their strengths and weaknesses are that we can work with them on to close those gaps over the time that we'll work with them. So at the end of the day, they're in a much stronger competitive position to go after Health Lead certification, for example, or the American Heart Association Fit Friendly Workplace designation, or if they want to go after a COOP award, they will know what it takes to pursue those things and will be in a much stronger position than prior to working through the advanced program. So we think that's a win-win for everybody. We get to help the participants refine and hone those skills, and they get to pursue, gold stars and silver level accreditations and these different types of opportunities that, fit their needs best.
Great. This is a follow-on to that, Jason. In the advanced program, in original Work at Health, there was a lot of work on completing the modules and putting forth the knowledge that was learned. In this advanced program, what kind of reporting will be required?
Yeah, most of the reporting is going to revolve around, again, this computer-assisted readiness tool, and that's a terrible name for it. We'll have to come up with something snazzier and short and sweet that everybody can remember. But, they'll enter in the program. We will sit down with them. We'll get them to complete this readiness tool. It'll kind of give us a baseline. Where are you at? Where are your gaps? Where are your strengths? And then we'll talk with you. We'll figure out what you're interested in, what's practical, what's feasible. This is where the art part of the relationship with the TA provider comes into play. And then over time, we'll look to close those gaps. And at the end of the process, we'll reassess, we'll reevaluate those things. We'll see, did you go from a 2 to a 5? Did you answer no to something? Now you're answering yes to something. So how have you improved, from the beginning to the end of the TA process? And really it's going to come down to just that pre-post measurement. There's not going to be a whole lot of additional reporting, if you will, required.
Thank you, Jason. We're coming to the bottom of the hour. I just want to ask one last question. Hopefully we can get this last one done, maybe fit in a couple more. But an employer wants to know that now that they've completed the technical assistance phase, but they might not be ready for the advanced program. If they don't sign up now, will they have chances in the future to sign up?
Yeah, we're making at CDC what we hope is a long-term commitment to Work at Health. The way our funding works, it's always kind of a year-to-year proposition, so I can't definitively say that for sure we'll have the opportunity for folks in the future, but we have every intent at this point to be able to continue to engage, train, work with, support employers through Work at Health, whether you're entering for the first time at the basic level, whether you've participated in the past and want to move on to advanced level programming. We'll kind of set up those different processes, what the requirements and eligibility for them are, and as I mentioned with some of those communication channels earlier from I think the first question that was asked, to kind of participate in our community, whether you are a formal trainee at the moment, or you're a graduate, or you participated but didn't complete the program and still want to be connected to the different employers and train the trainers around the country who have engaged with us. You know, this training and technical assistance hub will allow you to engage on different levels, from a very basic information communication kind of level all the way to, you know, we're working through program plans together online, those kind of things. So there'll be ways for you to understand what's going on, what we have available, and who's it available to, so that if now is not a good time for you, perhaps in the future you may want to re-engage more formally.
Thank you, Jason. I would so hate to say that we've reached the end of our time, but thank you so much for sharing your time and expertise with us today. I think it's been really informative. I really appreciate the time that you've given us, and I want to say thank you to the audience for participating. We definitely value your feedback and really appreciate you participating today. Finally, we'd ask that you respond to the rating poll on the right side of your screen. Any questions that were submitted that we have not answered, we will try to get back to you. We will get back to you with answers to those questions. If you have any questions or comments about today's event, please contact us at the information on your screen. I'll do my last plug here. Please remember to register for our upcoming events. Shortly, you will receive an invitation to join us for our next event, which is on Tuesday, March 10th at 2 p.m. Dr. Kessar Mukhtar, who is the lead for physical activity and walking programs with the CDC's Division of Nutrition, Physical Activity, and Obesity, will be our special guest, and she will be discussing physical activity and wellness programs in the workplace. Again, I'd like to say, Jason, thank you so much for joining us, and thank you, audience, for joining us. This concludes today's event.